Okay, so today we will discuss about a very high-yield topic, that is a hydrocephalus or hydrocephalus. So hydrocephalus or hydrocephalus are same thing. So before discussing the types of the hydrocephalus, first we discuss about the production of CSF. So CSF production take place in ventricles. So in this picture, you see that you see that these are the lateral ventricle. I'm highlighting in the red. So the production of the CSF take place by which cells? Ependymal cells, right? So ependymal cells are epithelial cells. And which epithelium is? Simple columnar ciliated. So ependymal cells are epithelial cells and they are simple columnar ciliated. And they are involved in the production of CSF, right? So ependymal cell and blood vessels form ependymal cell and blood vessels form choroid plexus, right? So this choroid plexus is basically involved in production of CSF, right? Okay. So CSF produced from the lateral ventricle, although the CSF produced in all the ventricle, whether it's the lateral ventricle. So this is the lateral ventricle. From the lateral ventricle, CSF moved to the third ventricle. So this is a third ventricle through the foramen of Monro. This is the foramen of Monro, right? So from the third ventricle, so this moves to fourth ventricle. This green show the fourth ventricle through which duct? Cerebral aqueduct. So the cerebral, this is the cerebral aqueduct, right? So the ventricle from the lateral ventricle to the third ventricle through the foramen of Monro, from third ventricle to the fourth ventricle through the cerebral aqueduct, and from the cerebral aqueduct to subarachnoid space through the two foramen, foramen of Luschka and foramen of Magendie. So foramen of Luschka is a lateral and foramen Magendie is a medial, right? So this is some uh, flow, and this when this CSF in subarachnoid space, it is then reabsorbed into the dural venous sinuses, right? So this is some of how the CSF flow. Rock, does it make sense for you?
Okay.
Okay,
Yes.
okay. Now moving toward the type of the hydrocephalus or hydrocephalus. So it is divided into the two types, the communicating and non-communicating. So the communicating mean non-obstructive and non-communicating means the obstructive hydrocephalus. Okay. So the communicating hydrocephalus further divide into the normal pressure hydrocephalus, right? So what is the triad of normal pressure hydrocephalus? Very high yield. So triad is a very high yield. So it is magnetic gate abnormality, right? Gate abnormality. It is urinary incontinence, urinary incontinence, right? And third one, so the triad of the normal pressure hydrocephalus, third one is dementia, cognitive dysfunction. So the third one is dementia, very super high yield. So the normal pressure hydrocephalus triad. And how will you treat this condition? By CSF drainage. So the treatment of this condition is CSF drainage. CSF drainage via lumbar puncture or shunt placement. So there are two ways. Lumbar puncture, so it will be lumbar puncture or shunt placement. So the normal pressure hydrocephalus triad is a gait abnormality, urinary incontinence, and dementia. And you will treat the normal pressure hydrocephalus to the CSF drainage, which may be the shunt placement and lumbar puncture, right? So the in normal pressure hydrocephalus, so it's typically affect typically affect elderly population, right? It is idiopathic. So the CSF pressure is elevated, increased CSF pressure in episodes, increased CSF pressure in episode or intracranial pressure in episode, episodically, right? Okay, so expansion of the ventricle, and this lead to the expansion of ventricle, right? And then this expansion of the ventricle take place in the normal pressure, again a high yield stuff. Expansion of ventricles will lead to distort the fiber of the cornea radiata. So these three triad symptoms are due to the distortion of the fiber of the cornea radiata. So this expansion of the ventricle distort the fibers of corona radiata, right? So very, very high yield stuff, right? Okay, now moving toward the increased pressure communicating hydrocephalus. So the most high yield cause is meningitis. So the post meningitis. So how the USMLE assess this kind of the hydrocephalus or cephalus, by giving you the symptom of the post meningitis symptoms, and they sometimes they ask about the which type of increase the risk of which condition, right? So they sometimes give you the CSF values, high pressure, high glucose in the CSF, these kind of stuff, and they want to know about the communicating hydrocephalus, right? So the high yield stuff is a post meningitis. The post meningitis will lead to the scarring, scarring of arachnoid granulation. So CSF is produced by ependymal cells and reabsorbed by arachnoid granulation, right? So this communicating hydrocephalus communicating is problem in reabsorption, reabsorption of CSF, so in which decrease reabsorption, while the communicating hydrocephalus, there is obstruction of the flow of the CSF, right? So obstruction of the flow of CSF is non-communicating or obstructive hydrocephalus, right? So hydrocephalus, what is the meaning of the hydrocephalus? What is the meaning of the hydrocephalus? So hydrocephalus mean increased CSF volume due to multiple causes, right? And this increased CSF volume lead to ventricle dilation. And it is not necessarily, so there will be increase intracranial pressure, like in normal pressure hydrocephalus. The pressure is normal. It is only elevated in episode, right? So it may be present with or may present with increased intracranial pressure, right? Okay. So again, moving toward the increased pressure communicating hydrocephalus. So it will it will be due to meningitis, right? So it will lead to increased ICP, increased intracranial pressure, papillary edema, and brain herniation, right? Okay, so the non-communicating hydrocephalus, it is typically caused by the blockage of the ventricle system. Is a blockage from the lateral ventricle to the from the lateral ventricle and through the end of this flow, right? So it may be due to one cause is aqueduct stenosis. Aqueduct stenosis. Second cause is cyst blocking, cyst blocking foramen of Monroe, right? So foramen of Monroe and there the tumor will obstruct the flow of this CSF, right? So non-communicating hydrocephalus. Okay, so there are condition that mimic the hydrocephalus imaging, right? So on imaging, you find that there is a increase CSF on imaging, but this CSF is not due to hydrocephalus, but is actually due to decreased brain tissue and neuronal atrophy. So it is due to the decreased brain tissue and neuronal atrophy. Neuronal atrophy, right? So can anybody tell me the condition which lead to the which lead this kind of the condition? This is also known as a ex vacui
Exactly.
ventricular. Sorry?
Yes, ex vacuo ventriculomegaly.
Yes, exactly. So it is a due to it also known as
Frontal.
ex vacui ventriculomegaly. Okay. So their condition that lead to this Alzheimer disease, right? Alzheimer, any other advanced HIV, HIV. Okay, neurodegenerative disorder. What is another name of this pathology? Frontotemporal dementia. So it is, I think it's a Pick disease. Am I right?
Yes.
And Huntington disease. So all of these four conditions and many more may lead to ex vacuo ventriculomegaly. And this ventriculomegaly is not due to the hydrocephalus. It is basically due to the decreased brain tissue and neuronal atrophy, right? So Hunting, right? Just give me 1 minute. My headphone battery is low. Just give me one. Okay, so ex vacuum ventriculomegaly is due to Alzheimer, advanced HIV, Pick disease, which is a frontotemporal dementia, Huntington's disease. So the intracranial pressure in ex vacuum ventriculomegaly is normal. ICP is normal, right? Okay. What are the signs of hydrocephalus in children? Can anybody tell? Very high yield. Signs of hydrocephalus in children.
Uh, bulging
Hello?
fontanelles. Hello?
Rob, can you hear me?
Yes, I can hear you.
Bulging of fontanelle. Sunset eye.
Okay, can anybody hear me?
Yes, we can hear you.
Can anybody hear me, please? Hello?
Hello, we can hear you.
Okay, so in hydrocephalus, there is increased head circumference, bulging fontanelle in children, upward gaze impairment, upward gaze impairment, and many more, right? Okay, so bulging fontanelle and sunset eyes. The sunset eye is basically due to the upward gaze impairment, right? So it's the same thing, up prominent veins on scallop, right? So these are the signs of hydrocephalus and prominent scalp veins.
Now, what was the first one you had? You had increased HP.
Okay, so what are the signs of the increased ICP? Okay, it will be
Headache, projectile vomiting.
capillary edema, right?
Yeah, Dr. Farzan.
Herniation, headache, vomiting, right? Okay, so let's moving toward the clinical vignette. Okay, Rob, can you read the clinical vignette one? Rob, can you read the clinical vignette one, please? Anybody can read the clinical vignette one. Is clinical vignette is visible or not? Okay, so I think now is visible, clinical vignette one. Rock, Asma, can you read it for me? Vignette one.
Okay, you hear me? Hello? Dr. Faizan, you hear me? Hello?
Okay. No, I cannot hear you. There is a technical issue, but can you hear me? Please try in the chat box. Okay, can you hear me? Okay, I think there is a problem because I changed my headphone, so that's why I am unable to hear you. So you can hear it. Okay, I will discuss. So Mr. John, a 72-year-old man, present with a 6 months of the history of the worsening shuffling gait. And the key thing is a gait. There is problem in the gait and urinary incontinence, right? So he wife notes as increased forgetfulness. So slow thinking on examination, wide based, and so there is what is the triad of the normal pressure hydrocephalus? So please write in the chat box triad. NPH. So the NPH triad is uh, in this vignette is present, right? In second vignette, a 4-month-old infant is brought by her parents due to the rapidly increasing head size. So rapidly increasing head size over the past 2 months, bulging fontanelle, abnormal head circumference, right? So the parent also report irritable and frequent vomiting, developmental delay. So this is a congenital hydrocephalus. So there are multiple causes of congenital hydrocephalus. So it may be due to cerebral aqueduct stenosis. Okay, cerebral aqueduct stenosis, Chiari-2 malformation, Chiari-2 malformation, and Dandy-Walker, right? So these are some high yield association with the congenital hydrocephalus.